Dr. Parijat, are you there?
I'm there always, Steve, always. All right, I'm at the
Excellent, awesome. How are things in
training. Hello, good evening, good morning, Dr. Baugher. How are you, Vince?
I'm doing great. Good to finally get to meet you, PK.
Good to meet you too, sir. Hi, Steve. How are you doing?
Hey, good evening there.
I guess Steve is the moderator for today's lecture.
No.
So, Dr. Baugher, hi, Curie. So, Dr. Vince, welcome to our team, sir. I'm Dr. Parijat. I did my studies in US as a physical therapist, and they did some spinal manipulation training over there. And right now we are currently in India. So we do these free lectures for the people to get aware about what actually chiropractic medicine is, who is a chiropractor, and what the chiropractors generally do, and what is the physiology, and whatever your thoughts are. Because what is happening in a lot of Asian countries and country like India, I mean, I hate to say this, but I would, because there are so many fancy YouTube videos which are there for marketing purposes, which we totally respect, but that is actually sending the message to the patient that they all want chiropractors. They are so fascinated from these cracks and pops that all the patients, they come and they say that, no, I want a chiropractor. Great. But the problem that I find professionally is that I'm not a chiropractor. Steve is not a chiropractor. But there are professionals who start using these names just to attract the market or just to attract the patients, which I think is not very right. So we request you to enlighten them all in telling how hard it was for you to become a chiropractor, how hard it is for a professional to become a chiropractor, what training is involved, how you become that, if you can throw some light on the difference of the chiropractic and manual therapy. We do a lot of manipulations of the spine and the joints. So yeah, they overlap a little bit, but I'm sure the chiropractic manipulations, they are quite different, and the profession is respectable, and they are way quite different. All right. So we welcome you, sir, and we hope to see you more and soon in our more program that is coming on. So guys, without further any wait, we will start because people do join a little bit late, but that's fine. All right. So you can throw your words, Dr. Stephen and Dr. Baugher. It's totally up to you.
Excellent. Yes. So let me formally introduce Dr. Baugher, and it's Baugher like lawyer, like the professional lawyer. So I know Dr. Baugher personally because I live in Denton. He also lives in Denton. We used to live in the same neighborhood. And over the years that I've been here, Dr. Baugher, I came to know that he was a greatly respected chiropractor in this area. And I would occasionally refer patients to him, and he would also occasionally refer patients to me. So we definitely developed a professional relationship and a mutual trust and respect for each other. Dr. Baugher, and he can elaborate on some of these things, but he's what I would consider to be a very holistic chiropractor, in the sense that he will treat the whole patient, the whole body, and take everything into account. There are some chiropractic clinics in the United States where patients walk in, they pay their money, they get popped, they get cracked, and then they walk out, and that's it. And so Dr. Baugher really has a very holistic practice. He does decompression, he uses other things besides just manipulations, and really cares about the patient as a whole. And I think as physiotherapists, we can really relate to that, because we also want to care about our patients and treat our patients as a whole person, and not just provide, what might be a quick fix or a quick stimulation that reduces some pain, but really doesn't fix the problems in the long term. And that's what ISOMT is all about. That's why we get so heavy into the biomechanics and the regional interdependence and things like that, is because we're really looking for, or we want short-term relief, absolutely, but we really want the long-term results because that's the greatest thing that the patient is looking for. They're looking to get rid of pain, and they're looking to be able to manage it on their own and keep it away on their own. And then they see us if they can't do that, or if they have any future problems. So without any further ado, so Dr. Baugher received his Bachelor of Science in Biochemistry and Anatomy. He has a Doctor of Chiropractic from Parker University, and that's in Dallas, Texas. And Parker University is basically the Harvard of chiropractic colleges. He has been in clinical practice for 23 years. He is the first doctor to bring spinal decompression to Denton County. So this county, I don't know what the mile radius for the county is, Vince, but I guess it could be maybe a 50-mile radius or so. His clinic, the Spinal Decompression Center, has been voted Best of Denton and Best of Denton County for the past 6 years. He's among the first 20 doctors in the world to be certified by the International Medical Advisory Board for Spinal Decompression. He's actively involved in his faith, the Baha'i faith. He's an active member of the Rotary Club in Denton for 14 years. He greatly enjoys community service and long distance running. When I used to live in a different part of town, early in the morning, I'd be driving somewhere and I would always see Vince running. I don't think I've told him that, but I would see him running many times, and he enjoys doing that. He's been married for 27 years with 3 teenagers. His eldest is studying artificial MIT in Cambridge, Massachusetts. So very distinguished chiropractor, very distinguished family. Thank you, Vince, for joining us, and I hope that you enjoy providing the lecture today. Thank you, PK.
Thank you, Steve. Thank you, Dr. Vince.
Thanks, Steve, for that generous introduction. And really, I'm honored to be here to present, not even present, to share with you guys, with fellow colleagues from across the world who are out there doing great work for others. So I'm not going to be so much teaching you guys, as I hear that a number of you may be professors at universities, but we're really just sharing colleague to colleague about a profession that you may not be as fully aware of. So I'm going to share my screen. I'm going to request to share my screen.
It's done, sir. It's done. Sorry about that.
All right. I am going to share my screen here. And cranked up here. Yes, this is my wonderful family here, my wife and our 3 kids. And so PK asked me to talk about what is real chiropractic, and I thought, well, what do you mean real chiropractic? And so that that introduction that you just shared with me helps me to grasp better what the situation is there. And chiropractic, as I understand, a number of you guys are physical therapists or kinesiology professors or massage therapists, and there is definitely some overlap between the work that we do. And so I'm not going to be talking so much about your professions or necessarily what exactly the intersections are, but I'll be sharing about chiropractic itself, and then you'll be able to recognize some of what those commonalities are that we have between us. So a little history of chiropractic. So spinal manipulation has been used for centuries. In fact, there are some ancient artworks from ancient Egypt and ancient Persia that appear to be demonstrating the use of manual therapies, the predecessors of my profession and yours, to help people get better or to torture people. It doesn't actually specify which one in these art pieces. And so chiropractic was founded just over 100, I guess it's 125 years, just over 125 years ago in Davenport, Iowa, here in the United States. And chiropractic literally means done by hand. And it was founded by this old gentleman here, Dr. D.D. Palmer. And chiropractic is not a part of the medical profession. It is a part of the healthcare field, but it's not part of medicine because we don't prescribe drugs, we don't do surgeries. Our approach is doctoring, but without the person who's now the chiropractor themselves or a family member. My own story is, well, I hear a lot of people, they were involved in sports and maybe they injured their back and they just couldn't get better and they couldn't play, or a bad shoulder or knee injury or something like that. And finally they went to a chiropractor and he got them back to playing sports, and they, the light bulb went off for them. For me, it was my mother. When I was 19 years old, she came down with epilepsy. You guys may know of epilepsy, the grand mal seizures. And long story short, she, after trying lots of different things that didn't work, she went to a chiropractor, and over the course of about a year, he got her back to virtually perfect health. And that was some almost 35 years ago, and she's still doing well today. So that was what triggered it for me to begin to look into this as a pretty cool profession to go into. Also, a desire to help people hands-on, and I know I'm preaching to the choir on that one, in terms of that's probably something that drew each one of you guys into this field, and to work with the body in a natural way, not using drugs, not doing surgeries, like I said, and honestly, this is one of the attractions to me, not having to deal with bodily fluids. Love being able to work on the outside of the body. So typical conditions we treat, and you guys will probably notice a lot of overlap with your field. Back pain, neck pain, headaches, migraines, sciatica, of course, the low back pain that travels down the leg, bulging and herniated discs, and that happens to be my specialization here, as Steve had mentioned early on. Sacroiliitis, inflammation of the SI joint, TMJ, shoulder pain, elbow pain, carpal tunnel syndrome, thumb and finger pains from arthritis or from overuse, hip pain, knee pain, ankle and foot pain. Did I leave out a single joint in the body? Really? And spinal stenosis, which honestly, that's a pretty tough condition. We still treat that, and a number of patients we get really good results with, but a lot of patients, the results are a lot more limited. And you guys may be aware of spinal stenosis. Let me grab my little degeneration model here. Spinal stenosis is where the vertebrae and the discs get so degenerated that the bone spurring begins to encroach on the nerve roots or the spinal canal, and can often cause nerve root degeneration, often permanent degeneration. And so, as you can imagine, once you've got bone spurs like that, you can't get rid of those. And often those patients do end up requiring surgery, but we have had some miracle cases that have gotten tremendously better with that. So those are kind of the orthopedic type conditions that we treat, but that probably, like I say, overlap a lot with what you guys see on a day-to-day basis. But then in the field of chiropractic, the scope of what conditions we often see get better because of the style of our approach tends to go a bit broader. And so these are conditions that we don't officially treat, at least in the state of Texas, it's not within our scope of practice, but that while treating the spine and other joints, we often see ear infections get tremendously better, allergies improve, sleep problems lessen, anxiety decrease, constipation ease up, gastroesophageal reflux get better, menstrual cramps calm down, and even breech babies. And this is another area that I specialize in a special technique called the Webster technique, which by treating the mom in a very, again, gentle way from the outside of the body, very often allows a breech baby to turn into the proper birthing position, which has prevented many, many C-sections. So I love treating our pregnant patients. PK asked me to go into a little bit of what it takes to become a chiropractor. So first of all, you get your bachelor's degree and you get it in whatever field it might be. Kinesiology, I got mine in biochemistry, and then another one in anatomy, pre-med, biology in general, something in the healthcare field typically is what people would get their bachelor's in. And then chiropractic college is basically a 4-year program. Some of the schools allow you to take classes during the summers, and you can finish in about 3.5 years after your bachelor's. And this chart is just a comparison between hours that chiropractors take and class hours that a medical doctor would take. And as you can see, there's a pretty decent corollary here. Anatomy, we take about the same amount as them. Chemistry, about half as much as medical doctors do. Diagnosis, about twice as much as they do. Microbiology, about the same. A lot of neurology, because people tend to think of chiropractors as bone specialists, right? But honestly, I'm not a very good bone specialist. If you have a broken bone, don't come to me. If you have cancer in your bone or infection in your bone, I'm not going to be any good for you. Chiropractors really are nerve specialists and joint specialists, because our job is to free up the nerves. And we'll talk about the mechanism of it here in just a few minutes. But to free up the nerves so that the brain can communicate with the rest of the body with its amazing healing abilities. And so we study a lot of neurology. Obstetrics, not as much. Orthopedics, a bit more, about the same amount of pathology, not near as much psychology and psychiatry for obvious reasons. A ton of radiology, because chiropractors rely a lot more on x-rays than medical doctors do for our diagnoses, because of course we are, like I said, dealing with the tool that we call bone, and that shows up on x-rays. So total hours, you can see, are pretty comparable to the hours that a medical doctor might take. In addition, well, medical doctors are taking, let's go back a little bit, taking pharmacology, immunology, and general surgery. We don't take really any of that. We take, in addition, spinal adjusting, a good bit of nutrition, physiotherapy, to learn more about the kinds of things that you guys are more specialized in than I am. And advanced radiology, MRIs, CTs, things like that. So here is just an example of what this a first semester, first trimester schedule might look like. This is not actually mine. That was 25 years ago or so that I was there. I couldn't find mine, but this is a typical one where you start early in the morning and you take classes pretty much throughout the day, and you've got your labs and things like that. Yes, very fond and intense memories of those 4 years that, or 3.5 years that it took for me to get to call myself a doctor. So what is it that chiropractors treat? It's what we call subluxations. So a subluxation is basically where a bone gets shifted out of place. And it can happen from seemingly simple things, like for girls carrying a purse that's too heavy, for us guys sitting on a wallet, talking on the phone while you're driving or typing, picking something up the wrong way, sports, slips and falls, carrying a baby on your hip the wrong way, sleeping the wrong way, anything like that, like seemingly natural or normal daily activities done wrong can cause these subluxations. And you can see in this diagram here, which bone is out of place, right? This second one in this spinal column. Now, this is a vast exaggeration of what actually happens. If this actually happened in a spine, you would be paralyzed, your spinal cord would be under so much pressure, you'd be in surgery immediately. But for graphic demonstrations, it's nice to have something that really stands out. So just knowing that this is an exaggeration, but this is basically what's happening on a oversimplified level. And that is, a bone gets out of place, causes pinching on a nerve, and that nerve gets inflamed. And then whatever organ or body part that that nerve goes to begins to get affected as well. So if it's the part of the nerve that goes down your arm, you can have arm pain. That goes down your leg, you can get sciatica. Up to your head can cause headaches. But as you can imagine, if it's affecting the part of your nerve that goes to your stomach, then it can cause digestive problems. Or your heart, it can cause high blood pressure. Or your lungs, it can cause breathing problems, things like that. And so while we don't treat those visceral conditions officially, by treating these subluxations, we begin to free up the nerves. And then this amazing creation, the human body, that we get to drive around every day, begins to heal itself in the vast majority of cases, just by freeing up that communication system between the brain and the rest of the body. So it's more than just freeing up joints, but that's the fundamental thing that we're doing on the inside. So how do we fix it? Well, like Dr. Fort said, by and large, chiropractors don't just say, oh, where does it hurt? Here, let me push on it. That all of that training that I just described would go out the window if that's all that we did was push on things that hurt. So when a patient comes into our office, we do an in-depth consultation about how they got, what they're dealing with, how they got there. A very thorough physical examination, orthopedic tests, neurological tests. We almost always take x-rays, at least that's the approach in our office. Some chiropractors take them less often. And then we sit down that evening, often in consultation with, I have 2 other associates who work for me, chiropractors, and we'll sit down together and we'll say, okay, let's look at all of the exam findings, let's look at the x-rays, and what the patient reports. Based on that, all of that, let's get the picture of what's wrong. Is this chiropractic? And if it is, what types of treatments will be most effective to get this patient back to living their life the way they want to? And so typically that will include chiropractic adjustments and any adjunctive therapies. We won't go into those today in this presentation. But there are a number of different therapies that we offer and that other chiropractors offer that might be different than we have in our office. And a typical plan, like I said, is not just oh, pop it and good luck, but 3 times a week for a couple of weeks, twice a week for 3 weeks, once a week for 4 weeks, and once every couple of weeks for a couple of months, starting to spread out the appointments as things begin to hold in place better. Now, like I said, this is just a kind of middle of the road treatment plan. There are patients who get less treatment. There are patients who get 8 or 10 months worth of treatment if they've got like a severe herniated disc. So the qualities of a good healthcare provider, and again, I am sure I'm preaching to the choir here, and you guys may have other insights that I haven't listed here that are even more important. But as I thought about for myself, what I think makes the best doctor, one is for us to truly care about the patient, for us to be confident in what we know and in our technique, not overconfident, not a know-it-all, to be an excellent listener, to really tune into what the patient is saying and to what they're communicating that they're not saying. thorough but concise communication. So not working to over-educate the patient and tell them everything that I know about this condition, and overwhelming them, but at the same time, making sure to share with them that which they would find most relevant and informative, so that it's not just, oh, I'm a doctor, trust me. Valuing the patient's time, and that includes both being punctual. Now, I don't know about in India and other parts of the world where you guys are, but here in the United States, we doctors have a reputation. We have two reputations: bad handwriting and running way behind and not caring about patients' time. Patients having to wait an hour, 2 hours in our office, and that's just the way it is. But if a patient shows up 5 minutes late, I'm sorry, you're going to have to reschedule. And so we strive to really honor the patient's time through punctuality and through keeping their visit as concise as possible, because as much as I want to think that I'm the center of this patient's universe because they're coming to me with all of this pain, they have lives that they really want to be outside my office living their life. And so we try to give them very quality time, but just as much time as it takes to get them taken care of and get out, living their life and enjoying it. Being honest and accurate with billing, having a clean, professional looking clinic. And I saved this for last, but I consider this to be the most important, and that is getting the patient's 3 essentials. And this I got from a friend and mentor of mine, Dr. Josh Wagner. So the 3 essentials: what actually is bothering the patient, how do they feel about it, and how is it impacting their life? So as an example, Ramesh, tell me what's going on. Well, doc, my leg hurts, and it's just frustrating, and I can't sleep at night, and I'm irritable with my kids. Or as often happens, what's wrong? Well, my leg hurts and I'm just so frustrated about it. And then reiterating to the patient, and I know this is not the treatment yet that we're talking about, like actually how do chiropractors treat, but this is, I think, the most important part, is really getting the patient's world. And so just to spend a couple more minutes on this. Okay, so Ramesh, your leg hurts and it's frustrating to you. Yes. So how is this impacting your life? Well, it's keeping me from being able to sleep at night. Okay, so you can't sleep at night because your leg hurts so bad. How else is it affecting you? Well, honestly, it's making me irritable with my wife and children. Okay, so your leg hurts and you're frustrated about it, and it's making you not be able to sleep at night and making you irritable with your wife and kids. Got it. Well, if we end up working together, then I'm going to take on getting rid of that leg pain so that you're not having to deal with that frustration and not being able to sleep and being irritable with your family. How does that sound? Again, a similar kind of pattern, looking at the patient's complaint. Okay, I've got splitting headaches and I just can't stand it. Okay, so you have splitting headaches to the point you just can't stand it, and how is this affecting you in your life? And I see there's things showing up on the chat. I want to address that, but I can't see what they are. And please feel free to put any questions that you have in the chat. And here in just a few minutes, before we get into some actual technique things that I'm going to share with you guys, then we'll address any questions that you guys have there. And I apologize, I can't see them right off right now. So You have splitting headaches to the point you can't stand it. How's that affecting you? Well, I can't focus at work and I'm afraid I'm going to lose my job. Okay, so these splitting headaches keep you from being able to focus at work to the point that you're afraid you're going to lose your job. I get that. So if we end up working together, always making it contingent, I'm going to take on getting rid of those headaches for you so that you can focus at work. You don't have to worry about your career and you can get your life back. And similarly, you guys can see my back aches all the time. So again, the first essential is what's their hurt? What's their problem? What's their dysfunction? What brought them into the office? And then getting their emotion, like really being with their emotion about it and validating that with your words. And then the third essential, which I really, that's what we focus on in our office, is what is it that's important to this patient? So to be honest with you guys, for years, honestly 20 years, I had it that the thing that should be most important to the patient is getting that subluxation corrected so that their nerve gets unpinched so that their body can function optimally. And that's what I would largely talk about, and some patients would get it. But then when Dr. Wagner shared this perspective with me, it turned my practice around. And in the last 2 years, my practice has grown almost 50% because of, and this is a significant, not the only part, but a significant part, and that is being with what the patient's priority is, not what I want them to get out of it, but what they want. Acknowledging it, owning it, putting it in my notes, because I'm going to forget, because we'll see, I might see 50, personally myself, 50 patients in a day, 250 patients in a week, and I can't remember that for each person, putting it in their notes. So it's right there in front of me every time, why they're here, so that that's always what I'm working towards, and patients appreciate that. So it doesn't matter to patients, fundamentally, whether they have subluxations, whether they have pinched nerves. It matters, can they play football with their friends? And so that's what I have begun to own, and taking the focus off of myself and my intelligence and putting it on the patient and what's really meaningful for them. Okay, I promised a break for questions. So now I'm going to open the chat and see, and acknowledge just what might be there. Namaste to all of you guys as well. Good evening / good morning. It's Twinkle Jaiswal. That's a beautiful name. It's wonderful to be able to, in the same moment, be in the morning and in the evening. I love the unity of the world and how that's become so much more evident during this pandemic as we're connecting with each other through this technology. These we treat in chiropractic care. I think that may be referencing the list of things that I just went through. And e-certificate will be provided. Yes, PK will address that. Maybe PK can go ahead and address the certification, how that will be handled.
Yeah, I'll let them know about the certificate, because generally in each lecture we have a quiz, like say 10 questions. People who pass, they get e-certificate, but I'll provide that message to the people, because this time we aren't doing any quiz per se, so we'll see to the certificate part, because I want people to work hard, not just come here for the certificate. They want to learn rather than just get the certificate. Okay. But Vince, there was a good question where everybody wants to know, and I know you know more about chiropractic. They want to know the difference between the chiropractic, and because most of them are physical therapists. So, and chiropractor is actually not there in the Asian countries. the school and actually the practitioner. It is some of the practitioner who practiced in other countries and then traveled and crossed the boundaries. So that's why. So yes, people can choose chiropractic as a career, as a skill, but chiropractic schools aren't there in India or any other Asian countries that I know. If you know, you're welcome to let us know. But it's not like you do a small certificate course and then you become a chiropractor. No, that's totally, completely unethical. And once they want to know that the difference between the manipulations or the, because it's an overlapping aspect, I know you can talk about more chiropractic. They want to know the difference in the manipulation, because see, PTs also have started practicing manipulations. There are a lot of fellowship and residency in states like Steve has done, or American Academy of Orthopedic Manual Physical Therapy. They do these fellowships and all where they teach all these manipulations, but I'm sure they are quite different. Not like big difference, but what is your stand on the difference? I mean, just a general idea.
Yeah, that's an excellent question. In many states in the United States, PTs are not licensed to do manipulations, but only mobilizations. So a mobilization, might be a working with in a slow manner, working with a particular joint. And a manipulation, you guys probably already know this, is the rapid movement of a joint into a new position. So that often involves a cavitation or popping of the joint. Now, I just popped my joint. I didn't do an actual therapeutic manipulation because it wasn't out of place and I didn't put it in place, so to speak. But so to address that, the difference between chiropractic manipulations, what we call adjustments, and physical therapy manipulations. So we won't even address mobilization. We've talked about that's a different thing, but the manipulation is a rapid movement that realigns a joint. And so within chiropractic itself, when I was in chiropractic college 25 years ago, there were 132 completely different styles of chiropractic. So not just different manipulations, but whole different styles and approaches, from some where all you do is you put a finger on a specific spot that you've analyzed to find where it should be, and a finger on another specific spot on the patient's body, and you hold there until you feel a pulse. That's called the bioenergetic synchronization technique. It's way on the gentlest end of the spectrum, and I don't fully understand how that works, but I trust that if people are getting results with it, then wonderful. To much more very aggressive manipulations. And I'll show I'll show a couple of the styles that we do here in our office. But I think the difference between chiropractic and physical therapy doesn't so much lie in the specific differences of manipulations, because those can be learned, but it lies in maybe kind of the overall approach. As I understand it, and I'm not a physical therapist, but physical therapists tend to focus on the functioning of a joint, restoring its function, reducing or removing pain in it, and getting a patient back to full functioning that way. Chiropractic, as Dr. Fort said, tends to focus more on the entire body. So when a patient comes into my office and they complain of headaches, I don't just analyze the cervical spine, but I check the entire spine, and I will see if there's anything else going on as well that I should look at. Do you have any knee issues, any wrist issues, any shoulder issues? And so each time a patient comes in, I'm looking at everything that I found from the beginning and adjusting or manipulating every segment that is still misaligned. And so I see you guys very much as my peers. I know Dr. Fort has just as much education and training as I have, and he and I refer back and forth to each other. So I don't know if that fully addresses the question, PK.
That does. And Vince, just correct me if I'm wrong, which, I mean, it's just my personal idea. When we are taught these manipulations, what my thing is, Maitland gave his grade 5 as high velocity, low amplitude thrusts. And if I'm not mistaken, I guess the chiropractors, they are more into, and I might be wrong on that. You are the expert. So chiropractors are more into high velocity, high amplitude thrust or moderate amplitude thrust rather than a low amplitude thrust. I don't know. I mean, I can be wrong because we are practicing more high velocity, low amplitude thrust, or you are practicing high velocity, moderate to high amplitude thrust. That's the difference. I think the amplitude of the manipulation or the range could be a little different in terms of the manipulation that a PT or a physical therapist does or a chiropractic does. The bottom line, guys, is we are not here to compare and differentiate between the two professions. We are here to help a patient. That's it. We need to help the patient. We need to help the society. Yes, sir.
Yes, yes, absolutely. And I'm very hesitant to correct a statement by somebody who I respect so much. And yet we use the exact same terminology, that what we're going for is high velocity, low amplitude thrust. You want a very small movement. If you do moderate or high amplitude, that's dealing with dislocations. If the shoulder is way out of place, totally dislocated, it needs a high amplitude relocation. But for the manipulations, no, exactly that. It's high velocity, low amplitude.
All right, cool. So we are same.
Yes, yes. I can, would you like to pick out questions for me to answer, or shall
yes.
I?
No, I can do that. That was, I guess, the main question people had. And one of the question when people had is they want to become a chiropractor like you. They want to be, because see, I don't want to encourage people to do any courses, short-term courses, and start writing chiropractor names in front of that. That's not what we are here for. We are here because Vince is a doctor in chiropractic. So please understand it, Vince. That's why they compared the medical and the chiropractic hours. There's a lot of training hours. It's a full 4-year program, I guess, Vince, over there after your undergrad. So please understand, we are not here for doing short-term or weekend courses and then you become a chiropractor. No, we are not here for that. We are doing an ethical, evidence-based program, all right, where Dr. Vince Baugher, there are osteopaths that we are having in a team, there's physical therapists, they all will be a part, and we are here to help people. Forget about the names, forget about the fancy names, forget about the certificates. Please help the society. That's what we are here for. All right. So if you are a physical therapist, please use the program that you are doing. You cannot become a chiropractor or a certified physiotherapist just by doing a short-term course. That's not ethically right. Okay, so if people are asking Vince that what to put after their name, you can put your last name after your name, but not like you are a certified physiotherapist or a certified physical therapist or a certified chiropractor. That's not a healthy practice. If you do a program from ISOMT, like we are running a certified evidence-based orthopedic manual therapy program, you can write that after your name or whatever program you do. But please don't make a mistake of writing a certified professional after you do any course. All right. Once I see some of some open mouth cervical X-ray you guys do, like for the fractures or anything like that. There's a question of using open mouth cervical X-ray. So in what conditions can you do that, please? If you can throw some light.
Right, sure. We do that in two cases, either to analyze for misalignment in the upper two cervical vertebrae, the C1 and C2, or to rule out the possibility of a fracture, such as after a car accident or a fall, a bad fall. If we're concerned, if the examination indicates there may be a fracture, then of course that's one of the reasons that we take X-rays, is to make sure that the manipulations, the treatments are going to be safe and that we are the right doctors for them. Yes, what you can put, as PK said, this is not, this program is not to become a chiropractor. And you're very welcome to come over and I'll give you a personal introduction to my university for you to pursue your chiropractic degree. But really the initials after your name, I think are just DHP, which are desire to help people. And you guys don't need to become chiropractors to be able to really dramatically change, continue to change the quality of people's lives. And I think the training that you've gotten is really wonderful. And it's just for all of us continuing to improve those skills. So for that next patient, I can deliver a higher quality result for them. And that's what ISOMT is all about.
Yes, that's correct. That's correct. Thank you, Vince. Vince, that is my personal question. I have one of the personal questions. Do you guys also do like a digital motion X-rays?
Not usually. There are a few who do, but those are only necessary really in situations of severe accidents. We do treat whiplash, but severe cases of whiplash where we may be concerned about significant instability, ligamentous instability in here. So typically static X-rays or sometimes flexion and extension static X-rays are totally sufficient for us.
Because I was reading some of the articles by Ross Hauser, MD in Florida, and he has that team of chiropractors, and he's himself is a medical doctor in Florida. So those guys do a lot of upper cervical spine instability and these digital motion X-rays and prolotherapies. And so I was wondering, is really prolotherapy done by chiropractors, and does that really help and evidence-based? I don't know. I mean, I know you know where I'm going with that.
Right. Yeah, there's a wide spectrum of adjunctive therapies that different chiropractors incorporate into their practice. For prolotherapy, occasionally I've referred out for that. We don't do it here in our office. Somebody mentioned diabetes. We don't treat diabetes, but yes, I have had numerous cases where patients were able to significantly reduce their insulin dosage because of the treatment that we've done here. Somebody mentioned T5 and T6. Not a single manipulation, but gradually retraining the joints as to their proper position and motion. There are some really good detailed questions in here that are kind of beyond the scope of the time that we have here, though I love the questions. And there's a decent chance that next year I may be doing a 4 to 6 module intensive program where we can get more in depth in the different aspects of not just what we do, but really this is about how to enhance what you guys do through me sharing. What I'd like to do is answer maybe 2 more questions just real quickly, and I promise to keep my answers brief, and then to get into a little bit more of the technique stuff. And I've got a couple of videos and live demonstration to share with you guys. Is that okay, PK?
That's correct. That's totally fine, sir. I got a question that that person asked me that, and I know it's a kind of a funny question because you just kind of entered our like high technique and the Asian arena. So one other person wants to know that how Vince can help us.
Excellent. No, I love that because again, it's not about me and, oh, look at what I do, right? That's irrelevant to you guys being able to take your practice to the next level. So we're going to get into a few little technique things that I want to share with you guys that some of you guys may already know, may even be doing better than I do. But just in case, we'll look at manipulation of the thoracic spine, the elbow, and the ear. So just three little ones to share so that you guys actually have a takeaway. I'll address, let me just do one more question, and that is chiropractic and osteopathy. So they started like right about the same time, 1893, 1895, something like that is when osteopathy started, just right about the same time, and I think even the same part of the country. And Dr. Andrew Taylor Still was the founder of osteopathy. And he found basically the same thing, that if you get the joints moving properly, then it frees something up and the body gets healthier. So Dr. Palmer said it was the freeing up of the nerves that come from the spine that allowed the body to get healthier. And Dr. Still, who founded osteopathy, he said, no, it's the blood vessels. It's freeing up the capillaries that are getting pinched. But when you free those up, doing the same manipulations, basically, then the body gets healthier. So each one of them kind of founded their own practice, amazingly right about the same time. And the difference comes not so much in how they started out, but in what direction they went. Excuse me. So chiropractic swore off of medicine and said, look, we're going to do it naturally. To a fault, I would say, in terms of demonizing medical doctors and the entire medical profession. But osteopathy, it kind of got offered the opportunity to, if it stops talking about all this vitalism and how the power that made the body heals the body, and you free up this inner force, and so they got welcomed into the medical profession. And so now a DO can specialize in anything that a medical doctor can, except for, I think, neurosurgery and psychiatry, something like that. But most osteopaths these days don't incorporate manipulations in their practice at all. They just do their surgery or do their general practice. Or there are some who do it kind of a little bit on the side, but it's definitely not their specialization. So they tend to be basically medical doctors with a slightly more natural inclination. So that I want to get back to, I would love to be able to address every one of your questions, excuse me. But for right now, I want to get back to the presentation so that it can be as practically beneficial for you guys as possible, and not so much of just listening to Dr. Bentz speak. So let's get back into the old screen share. Okay, so full spine manipulation. I have two brief videos of two different techniques that we use in our office. And I think each video is only about 2 minutes. And let me make sure I share sound. Let's get this up here. Hello. And when I practiced this, it launched well. There we go.
So many people really want to go to a chiropractor to get relief, but they're afraid of, oh, I don't want to get my neck cracked. And what they don't realize is that there are different techniques that can be much more gentle than the manual adjustments. For example, one that we use here is the Activator, which is a little instrument that basically just gently taps the bones into place. And no, there's not a needle on the end. And in fact, it doesn't feel like it does much of anything, but on the inside of the body, it really moves things. It's all about speed instead of force. And so it gently taps the bones into place, just like a manual adjustment will move them into place.
Sorry to interrupt you. Sorry to
Yes.
interrupt you. Yeah.
Yes.
See, when we are running the Zoom meeting, the technicality is sometimes the YouTube video is not shared. So it does not get shared if you play a YouTube video on a separate window, some technicality, because we have done that too. So it's okay. I mean, I can share the links with the people. They can see it on their WhatsApp group if you want. But yeah, the YouTube video will not be visible if you share the screen. That's the problem.
Got it.
Yeah,
thank you.
now you can see it. Yeah, now we can see it. Okay. Yeah, there you go.
My bad. I'll just start it from right here.
It moves things. It's all about speed instead of force. And so it gently taps the bones into place, just like a manual adjustment will move them into place. This is one of my associates, Dr. Laughlin. He's now going to give me a chiropractic adjustment using the Activator so you can see how it works. He's using his hands to feel which vertebrae are out of alignment. Then he lines the Activator up specifically along the direction of that joint to tap it back towards where it's supposed to be. This lubricates the joint, but it also creates more flexibility in that stuck joint, and it takes pinching off of the nerve that's going through that joint. You can see that this type of adjustment doesn't require any twisting or pushing or cracking. It's gentle, but very precise and effective. This actually is the preferred method of adjustment for a lot of our patients, especially our older, like more senior patients, as well as children and infants. In fact, some kids even giggle when they get adjusted and say that it tickles. Many babies have slept right through their entire adjustment. It's also great for pregnant women or those in a lot of pain or with muscle spasms, as well as for smaller joints like some of the joints in the knee, the ankle, or even the TMJ.
Okay, so that was one style of manipulation that we do in our office. And here's another brief 2-minute video of the other primary style that we use.
This is one of my associates, Dr. Kirkpatrick. He's now going to give me a chiropractic adjustment using the manual method so you can see how it works. We do both instrument-based adjusting and manual adjusting, depending on what works better for that particular patient. And we feel or palpate the spine to see where there may be restrictions. And then we line our hands up specifically in the direction of that restriction to gently, quickly give a little thrust to release that. It's actually quite different than popping our own necks or backs, because with it being done by a professional, by a chiropractor, we can isolate the segments that are stuck and release those without messing anything else up. The positions at first may seem a little bit awkward, but after you've been adjusted a couple of times, you'll notice that you just kind of naturally flow into the position. This adjustment of the low back really can release stress and tension in that area. The popping or cracking sound that you sometimes hear with the manual adjustment is actually air pressure being released from within the joint at the same time that the joint is being realigned and put back into its proper position. Some people are a little leery at first of a neck adjustment, but as you can see here, he just gets it a little bit turned and then quickly, gently, you can tell I'm under no stress at all right there. Immediately after this adjustment, the neck feels so much better.
All right, so how do you deliver a good joint manipulation? Again, you guys probably all, the vast majority of probably already know these. Make sure that it's safe, you know, like you want to rule out fractures and things like that. Make sure that it's appropriate for this patient, that it's the right thing that they need. Make sure you're on the right joint, be on the correct side of that joint that needs to be manipulated into place, and you assess that through palpation. Speed or quickness, high velocity, low amplitude, as PK said, and then the depth of thrust. So you got the high velocity and the low amplitude there. And as you could see, each of those manipulations that both of my associates were doing were very low amplitude. So for a thoracic manipulation, I want to demonstrate these three manipulations real briefly. So again, you want to rule out fracture, rule out any signs of infection or cancer or any visceral cause. And the best way to determine whether something is a musculoskeletal problem versus visceral is if it's musculoskeletal, it'll tend to get better or worse depending on the position that you're in. If you've got a kidney stone, it doesn't matter what position you move in, it's not going to ease off. So we are going to, this is Ryan. And I'm going to stop share here so we can see a little bit better. There we go. Where is it? This is Ryan. He's going to lie down on the table for a thoracic adjustment. You okay with that? You can lie face down.
Thank you for helping us, Ryan.
And so I've adjusted Ryan many times. And so all of that initial assessment has already been taken care of. Right now, I'm feeling for where his primary restriction is. Then I'm going to line up my hands along the hypothenar eminence, primarily with the pisiform contact, right on that segment, both sides of the segment, but it's twisted off back on the right. And so primarily my thrust is going to be on the right side. Take a deep breath in, relax it out. And there's your thoracic adjustment. So this is a joke, I'm gonna put you guys in breakout rooms and you can manipulate each other. You can stand up, Ryan. We're going to now do an elbow adjustment. So there's two primary joints to the elbow. There's the radial head and the olecranon. Any issues with your elbow? Is it okay if I do this? Okay. So is it okay if I keep my mask off just for this, for right now, just for the presentation? So the non-manipulating hand stabilizes the lower arm there. My thumb contact is on the posterior aspect of the radial head. And then the manipulation will be bringing it to tension, bringing it just off of tension, and thrusting primarily with this thumb and slightly pulling back with the non-manipulating hand. Sometimes you'll get a cavitation, you got a small one there. Then can we turn 90 degrees this way? For the olecranon, I'm going to put my hand like this, thenar eminence and knuckles on either side of the olecranon. This is for a posterior olecranon. We can turn back around. And then this hand, similar contact. And like that. If you don't get a cavitation the first time, it's okay to try once, maybe twice more. Sometimes you can get movement like I felt on that second time without a cavitation. Cavitation is that popping sound. And so if you get the movement, then go ahead and stop. You don't have to hear the pop. And then finally, we're going to do an ear adjustment. Have you had your ear adjusted before? Yes. Okay, cool. This is a fun one. So you can sit here facing this direction. This is awesome for actually face that way. Yeah. If a patient has pressure in their ear, a bit of hearing loss that seems obstructive, but there's not actually anything physically in there, then you can free up the eustachian tube very often with this. And if they have mild to maybe moderate ear pain, like from a mild to moderate ear infection in there, the more severe the pain is already, the more painful the manipulation is going to be. So don't do it if it's really severe, if it's red and inflamed, but mild to moderate, very often it'll open things up, things will drain right away, and patients can get fairly immediate relief. So grab the earlobe, and the motion is going to be down, out, and up, all feel or hear that move. There we go. You guys might have even heard that there. You okay? Yeah. Good. So that one freed up really well. Thank you, Ryan. So those were the 3 techniques that I wanted to share with you guys that may add to your repertoire. And just like everything that you've already been practicing in your practices, seeing it done once doesn't make you an expert at it. And so it will take practice. This has been recorded, and so I assume you can go back and watch it. And if it's within your scope of practice, and you have done all that's necessary to make sure that doing this with the patient is safe and appropriate, then I give these as gifts to you, my colleagues across the world. And so I'll turn it back over to PK. That's the end of my presentation for today.
Well, that was great presentation, great demonstration, Waynes. I really appreciate that. And the ear manipulation and the nose cartilage manipulation, we understand that you guys are expert on these manipulations and the chiropractor. But once again, guys, this was done by Waynes, Dr. Waynes Baugher. Yeah, that's lawyer like Baugher. So sometimes I get confused. So yes, that is done to help you guys treat the patient in an evidence-based and an ethical way. Forget about the names after your names. Forget about the credentials and all. It's good to practice evidence-based and ethically and help your patient. Full stop. And ethical. And that's how you get the business. All right. So Waynes, we hope to see you soon again with our full elective course. As you said, we will wait for, and I'm getting a good response. Believe me, I'm getting a lot of messages because I understand everybody wants to be a chiropractor, but guys, it's not that easy.
And you guys are already great as physical therapists, massage therapists, whatever you're doing. Like PK said, the title is not what matters. Just getting out there, serving mankind, helping us to, helping people to be able to do what they were put on this planet to do, and just continue doing the wonderful work that you're doing, and continue increasing your skill level. And I'm so happy for ISOMT making this available to people across the world.
Well, thank you so much, Waynes. We appreciate your time on a weekend and doing all these demonstrations. We can't thank you enough. So guys, if you have any questions and concerns, you're welcome to access our website, theisomt.com. There is email address, there's contact information. We hope to see Dr. Waynes again in an elective course as per his time and availability allows. And we hope to see you soon, sir. All right. Any question and concerns, you can direct us. You have a good weekend. You have a good day, sir. Thank you.
Awesome. Thank you.
You're welcome.